So we have this repair of this facial nerve, and at the same time we have to think of another important structure, which is the cochlea, which has the cells for differentiation of the type of sensory stimuli by way of the sound impulses. Here sometimes if cochlear is not working properly, then they can place a cochlear device, which is the artificial device, because here again there might be tumors of the cochlea or any degeneration of the cochlea. In such cases they can place a cochlear device as a method of replacement processes. To end with, we are just going to see one particular important code called as a usage of microscope. This code, which is actually a plus code with 69990. Here what you should understand is, you will definitely get one particular question with the usage of this code. This is actually the usage of microscope. We have a separate code. You should know whether the primary procedure includes the usage of microscope. Say for example, if you see the code 19367 or to 19368, what happens is like that procedure itself includes the usage of microscopic technique. So you don't have to report it separately. How you can figure out it is very easy. Just go to this chapter section on 69990. There you will find a list of CPT codes that are being given in brackets. So with all these codes, you are not supposed to report the 69990 code. That's all. There will also be a range. Say for instance, if you see the code 15756 to 15758. So the codes are 15756, 5758. With those codes, you are not supposed to use a 69990, because you will definitely have an option with the 69990 and without this microscopic technique. So in that case, select the code accordingly. You will have to see what are the code sets that are given under this particular section. If these codes are there, then you are not supposed to report the operative procedure as a separate code. In some patients, what they can do is like, when a patient has dizziness, the physician will have to inject some vasoactive substances or drug substances into the vestibule. So injection procedure. So for that we can report the separate codes. So here, coming to the end of this auditory system, the coding is pretty simple. Just understand the anatomy, see where the medical necessity or see where the problem is and what could be the probable conditions. Mostly you will have questions with tympanostomy, the ventilating tube removal and all that stuff, and of course with the cerumen impaction. I hope this session would have helped you in a bigger way. We'll see you in our next chapter. Thank you.